like this would be easier.
Nobody is in yet, is it? You haven't opened the.
There is about 33 attendees who have already in the call.
Hi, Prof. Wan. Good morning.
Good morning, Prof. Wan. I think she's muted.
Hi.
Hi.
How many are we expecting?
We have about 300 people who registered for the webinar today. So probably half, or slightly more than half will turn up. We'll wait till
Okay.
about 11 o'clock or 11:03, something like that before I start the call. Good morning, everyone. We will be starting in about exactly 2 minutes, just waiting for more people to come in and join the call. Thank you. Okay, a very good morning, everyone, and welcome to our webinar titled A Trial for Change, the Piper Study and its Impact on Head and Neck Cancer Treatment. So before we begin the webinar today, some housekeeping rules. If you have any questions, it will be answered at the end of the webinar. You can drop your questions in the question answer box and I will read them out. Of course, it depends on the time that we have at the end of the webinar, but we will definitely allocate about 5 minutes for a Q&A session. Okay. And regarding the e-certificate, I know a lot of you like to ask this question. An e-certificate will be certificate for attendance will be provided within 30 days after the webinar is over. Okay. Okay. So, a very good morning to Prof. Can you come on the call? Can you on your camera, please? Prof. Are you there? Okay. So, a very good morning to everyone. For our webinar today, we have Associate Professor Dr. Zamaniah Ishak, who's a consultant clinical oncologist from Universiti Malaya. And joining us also is Professor Ching, Chief Scientific Officer of Cancer Research Malaysia. Good morning.
Good morning, everyone.
Morning. I am just waiting for Prof. to join back. I think the call.
Yeah, she dropped off the call.
Drop off, yeah. So let's just give her a couple of minutes for her to join the call. How are you doing this morning, Prof. Cheong?
Good, good. Seems like you and Amanda have been very busy with all our webinar series.
Yes.
And the public gets to meet our scientists behind the scenes. So I think That's great. And I just want to thank everybody for making time to come and listen to our work, especially in the area of clinical trials.
Mm.
I think majority of the people may or may not know that Cancer Research Malaysia is very active in terms of their research, and some of these research are now transcending into the clinic, and that's why it will be really nice to be able to tell people about it. And specifically, as you mentioned today, we're only talking about one trial, but we have two completed already for breast cancer, and one that is about to start in lung cancer. But we don't have time to cover everything, so stay tuned to all Vishala and Amanda's webinars, because we'll be bringing all these updates to you all periodically. So keep in touch with us.
Thank you, Prof. Cheong. We will just wait for
I
Prof.
think
Wan
Prof. One messaged me and said she might have some problems with the internet. Yeah.
connection. Okay, we'll just give her a couple of minutes to join. But again, I would like to thank all our attendees. They have been very supportive with our public webinars, attending them. You know, very constructive with all their questions, interesting questions they have. I think I've also learned. Oh yeah, that's
Prof. One's here. Hi, Prof. One. So
Hello,
sorry to hear
can you
you
hear?
have some issues. Yes, and we
Yes.
can
Okay.
see you perfectly fine.
Yes.
Yeah.
Prof. Wan, how are you doing this morning?
I'm fine, thank you.
Okay, so without further ado, I'm going to get diving into the webinar today. Prof. Wan, we have heard about breast cancer, colorectal cancer, there are many kind of cancers out there. But what is head and neck cancer, and is it very common in Malaysia?
Head and neck cancer is a cancer that occur from the shoulder and above. So because there's complex structure of our head and neck region, we have a lot of critical organs: the eye, the brain, the salivary gland, the tongue, and all other organs and other organ as well. So make it unique because the tumor can come from any of these organs. But the most common ones will be from the epithelial tissue lining inside our how do I say, head and neck region, which is the squamous type. So 90% of the head and neck tumor is actually from the squamous cell type, which is squamous cell carcinoma. But there's always salivary gland tumor, sinonasal tumor, which is from the sinus and the nose. And there's always NPC, which is the tumor behind the nose. But we are not talking about salivary gland or sinonasal tumor in this context. How common is it? In Malaysia, it's around number 8 to number 9 common tumor. But of course, when you see the report from the Ministry of Health, you don't see it head and neck tumor. They split it, the tongue tumor, the oropharynx tumor, which is inside the mouth, and inside the pharynx, which is the area behind the throat, as well as the larynx. So they split it in that sense, but the behavior of this tumor normally is the same, and normally we lump it into squamous cell carcinoma of head and neck, which make up about 90% of the tumor of the head and neck region.
Okay, so it's one of the top 10 cancers in Malaysia considered.
Correct.
And I know there are different regions and there are different cancers between the head and neck, but do they present any common symptoms, signs and symptoms?
Okay, it depends on where it presents. For example, in the tongue or in the lip, there will be lumps and bumps. They can be non-healing ulcer. They can be bleeding if they are too big. They can cause pain. If it's in the throat, the patient can present with difficulty in swallowing, pain in the swallowing, bleeding as well. Non-healing ulcer. Basically, it depends on where it presents. If it's present in the larynx, a patient can have a hoarseness of voice, pain, and like I said, difficulty in swallowing. If it's present and some bleeding. If it's present in the nose or behind the nose, they can have nosebleed and sinus, or what the normal common public calls sinus all the time. So those are the common presentation, and it depends on the size of the tumor as well. If it's too big, it will cause a lot of local problem, let's say mainly pain, and sometimes they can have like if the nerve being compressed, they can have symptoms that depends on the nose as well, and nerve as well.
Okay, so I know this is going to be a concern for everyone because sinus is a common thing among Malaysians. So, is having sinus a symptom, or should people be worried?
It is not exactly the symptoms, but one of the symptoms. If it become a concern, then consult your doctor. Go and see your doctor. Because our ENT surgeon normally will scope and see what is the main issue there. If there's any lumps and bumps or polyp that they can excise, or it's just like chronic infection or chronic fluid accumulation in the sinus. It can be benign, and as I said, it can turn to be malignant as well.
Okay, so whatever it is, I guess taking precautions is very important.
Yes.
Okay, so Prof, what are the challenges with the current treatment for head and neck cancer?
In Malaysia, the treatment, the tumor of head and neck normally presented late. Patient come to us where they already in stage 3 to stage 4, maybe because of the awareness are not so much. One of the main factor that contribute to head and neck tumor is smoking, human papilloma virus infection, Epstein-Barr virus infection, as well as family history is one thing, and our how do I say, lifestyle,
Risk habits.
Habits, eating too much preserved food that can contribute to those infections, those problem. And not many people aware of head and neck tumor. So when they presented like nosebleed, like you said, maybe patient think that it is just sinus, or is it just hot? Like you know, the Malaysian will like to contribute is hot nowadays, kepala panas. So the bleeding can be because of that. So not many people seek attention until it was too late, like more than 2 months presentation of voice changes, nasal, how do I say, nasal, nasal voice. Then only they go and seek seek treatment, and that can be a bit too late already. And normally from our own data, we can see that the patient presented at stage 3 to stage 4. And when patient presented at stage 3 and 4A, normally we can still cure them with the combination therapy, surgery, chemo, and radiotherapy. But for those who presented at stage 4B, where surgery is too late, then the treatment will be palliative chemotherapy and plus minus immunotherapy as what we have at the moment. So when we are talking about stage 4B, cure in this type of tumor is almost very difficult. Not to say almost impossible, but can be very difficult. The lifespan also shortened, and that's why early detection is very important.
Correct. And when you say that symptoms can be something that people may take as very normal, like it's heat, or I'm just having allergic reaction.
Correct.
So it can be very often overlooked. But I think a very good indicator, you say that if it goes on for 2 months, it happens every day, then you need to go and get it checked.
More than 2 weeks normally, what we advise. Yeah.
Sorry.
Don't wait until 2 months.
Okay, more than 2 weeks. Okay.
Yeah.
Thank you, Prof. Wan. Over to you, Prof. Cheong. So what is the Piper trial all about?
Yeah, so Piper is actually just a short name for a very long name for a clinical trial. So the clinical trial name is very long. It's called a study of pembrolizumab plus platinum and gemcitabine. So the name goes very long, and usually in order for clinicians and ourselves to refer to a trial, because people like Prof. Wan, she would have many trials running on different diseases and using different drugs. So in order to make sure we are referring to the right trial, first of all, we give an acronym to the trial, and this is called the Piper trial. And the Piper trial essentially is us at Cancer Research Malaysia working with the clinicians, both such as Prof. in Universiti, Malaya, and also those at the Ministry of Health Hospitals to come up with a program or a project to test a novel combination of chemotherapy and immunotherapy. I think most people understand that if you have cancer, one of the ways of treating the cancer is chemotherapy. But today, obviously, many immunotherapy drugs have also been approved for the treatment of cancer. And immunotherapy, in the simplest term, basically is a kind of drug that removes the brake of the immune system so that the immune system can now see the cancer as being foreign and attacks it. Yeah, but immunotherapy now is approved globally with chemotherapy. However, the regime that the chemotherapy drug that is approved together with the use with immunotherapy for head and neck cancer is not a chemotherapy that is commonly used for the treatment of head and neck cancers here in Malaysia, simply because when patients are given this drug, they have to be hospitalized, and sometimes, given the low resources, this is not always possible. So therefore, the Piper trial is to check whether the combination of the chemotherapy that we use here in Malaysia can work well with immunotherapy, and this has not been tested anywhere else.
Okay. Okay, and just to understand further, you said, it reduces hospitalization and all that. What else does it do? I mean, I understand, if we look back at COVID, right? When COVID happened, the main attention went to COVID patients, getting them admitted, hospital beds were full. So it was very important if we have this kind of combination treatment so that people don't have to come and stay in the hospital. It puts them at risk as well. So besides reduced hospitalization, what else does this combination do?
So we need to think about how drugs work, and actually drugs work differently in different populations. So the drug that we are testing in combination with immunotherapy, the chemotherapy that we're using, has also been shown to have less side effects among Asians compared to Caucasians. So in addition to demonstrating that this chemotherapy works well together with immunotherapy, as well as, if not better, than the chemotherapy that has already been approved by organizations like the FDA. We also want to show, or we want to analyze if the chemotherapy that we use today with the immunotherapy also are associated with less side effects in our patients, which theoretically or biologically speaking, we should expect to see.
Okay, very interesting. There's two factors. It reduces hospitalization. Basically, it reduces the hospital burden, burden to the healthcare system, and as well as you want to see whether it reduces the side effects or toxicity level. Very interesting. Cheong, this question is for you as well. Cancer Research Malaysia is a non-profit organization, and we are fully focused on research and community outreach program. Why do you think Cancer Research Malaysia is being the forefront in conducting this trial?
So Cancer Research Malaysia, as I mentioned, works with the clinicians because doing clinical trials is really a multidisciplinary team, right? First of all, our scientists work closely with the clinicians to identify the gaps. What do our cancer patients need? Sometimes it is a need for understanding the molecular basis of cancer. So for example, identifying a biomarker that could help us identify patients most responsive to a particular drug. And because we are scientists, we are able to understand the biology and do the experiments in order to find this biomarker. But sometimes it's just about, would this therapy work better and have less side effects? And that's where we put our heads together with the clinician in order to find evidence in the literature and what we understand about the biology. And this is really a partnership. We cannot do it without the clinicians. But certainly Cancer Research Malaysia is at a very good position in order to do that, because we have a lot of Malaysian scientists on board that understands what are some of the needs that we have to address in Malaysia, particularly in the treatment of cancers. And because a lot of our research starts also with our clinicians. So if we are looking for biomarkers or analyzing any gene, typically we always start our projects with the clinicians, so that every step of the way, whatever we identify, we know how it can be translated into addressing some of these gaps in the clinic. And that's why the partnership between Cancer Research Malaysia and our clinicians is so powerful.
Thank you, Prof. Cheong. I think it's very important to have these partnerships. You know, at the end of the day, it's having the patient in the middle and having their heart and making sure that they recover and it benefits them. So it's nice to see this collaboration, this partnership between NGO and Universiti Malaya. It's great job to both of you.
Yeah, I have to agree with that, because the clinician, to be honest, although we are clinician scientists, but we cannot do everything ourselves. We need pure scientist support, which Cancer Research Malaysia is giving us the support. To be honest, I cannot do without Prof. Cheong. She's the driving
Thank you very much,
force.
Prof. Wan. That's very kind of you to say.
She is very the force behind this clinical trial, basically, and she's been driving me in a way with whipping whenever
You're giving me a very good reputation here.
Necessary for somebody busy like us.
Yeah, that's very important. The point you shared, Prof. Wan. You know, clinicians have a lot of their plate as well, so it's important to have this partnership, this collaboration, to ensure whatever that they're doing is successful.
Correct.
So, Prof. Wan, this question is for you. How could the findings from the Piper trial improve cancer treatment in the future?
Okay, because we are testing combination of pembrolizumab plus chemotherapy, which has not been tested worldwide. They have been the previous approved combination is 5-FU plus cisplatin or platinum, and also paclitaxel, which is taxane plus platinum, which the study conducted in Australia and New Zealand. But for this combination, which is platinum and gemcitabine, it has not been tested before. It is proven to work in the nasopharyngeal carcinoma very well, the cancer behind the nose. But for the cancer oropharynx, larynx, and pharyngeal, it has not been tested. So if the findings is successful with the combination of less toxicity, very effective treatment, then we can use this combination. I mean, not only us, but worldwide can use this combination as well, which will bring Malaysia to another level.
Now that's really good. I mean, Malaysia is starting this off. I mean, a country as we are geographically smaller, but we are doing really groundbreaking research that will benefit everyone around the world.
Yeah.
Okay. So, Prof. Wan, another question for you. We know new treatments and medications can be expensive. Immunotherapy is the latest. So what's your thoughts on the cost effectiveness of the combination medication used in Piper?
We are using the older drug chemotherapy, which is platinum and gemcitabine, and that is a very cheap drug nowadays, in very heavily subsidized by the government, as well as cheap. But immunotherapy, of course, still in their patent time, quite expensive. But with Piper is currently ongoing, we are providing in a way FOC treatment for the patient. So for the patient currently, they will get the treatment FOC. But in the future, hopefully, when the more and more how do I say immunotherapy coming up with the patency of the pembrolizumab going to be expired hopefully soon, and with the biosimilar coming up, I think the price can be reduced to significant amount, and hopefully our patient will be benefiting from the treatment.
Interesting. Because, when we look at cost effectiveness, it's just not the cost of the medication. You got to look at the whole picture.
Correct.
Yeah. I mean, it's because
The hospitalization, the side effects,
effects,
the supportive drug that being used during the side effects, and those come into cost to patient as well as to the government. So
Yes.
if we use treatment that is effective, less side effects, that actually will save us a lot of money to the
much
patient
more
as well as
sustainable.
to the patient as well as to the government.
Okay. Thank you, Prof. Wan. Prof. Ching, this is for you. Why do we need to conduct clinical trials here when it may be easier to conduct them in Western countries where funding is more accessible?
Yeah, before I answer that question, Vishala, I just want to also add on to the comment from Wan said about immunotherapy is now hopefully might get cheaper. In our coming trial as well, we are also looking at lower doses because we know that the current dose basically is likely to be too much. And on top of that, there's a lot of side effects when you overdose the patient. So we are looking at the trial where we can reduce the dose and also increase the duration from one treatment to another. We hope that will work. The science tells us that it will work, and that's why we need to do the trial here. And that will start very soon in several Ministry of Health hospitals and also in 2 private settings for lung cancer. So look out for that. To answer your question about why do we have to do these kind of research and clinical trials in Malaysia, the answer is very simple, right? We are Asians, so we have certain genetic variations that are different from the Caucasians. The things that we eat and the habits that we have in terms of risk habits are different. We have different healthcare system, right? We do not have Obamacare or NHS here. We have very different healthcare systems, and definitely we have very different beliefs. So a Caucasian may, say, oh, I have breast cancer, I'm going to see the doctor. But in our population, maybe that's not the case. If a woman has breast cancer, in certain communities, they're going to hide it. They're going to hide it until they cannot hide it. So these are the considerations that we need to have when people ask us with this kind of questions that you just posed to me. Why does it have to be done here? Why can't we just take results from the MD Anderson Cancer Hospital or wherever you think have very advanced research and apply it here directly? So the answer is because we have different genes, we have different habits, etc. So for example, right, there are certain genes where mutations happen more common in Asia. And because of that, we actually will be more amenable to certain kinds of drugs, such as immunotherapy. And there was a trial that we did successfully for breast cancer. So back to the PIPER trial, we already know why we're doing the PIPER trial, because even the drugs that we use here for our patients is totally different from the drugs that will be used in America. So if a drug combination is approved in America, it doesn't apply here because we don't even give that combination. So how are we going to make sure that the combinations that we give here are safe for our patients? We can only do that when we do the clinical trials here and measure the response and what are the side effects.
Okay, thank you. Thank you, Prof. Cheong, Prof. Wan, you have something to say?
If I may add to that, and the dosage approved in the Western population is you cannot apply it to our population because the body size of our people here is slightly different. The Asian, although the Malaysian, they said the how do I say, one of the obese problem in Asia, but still lady size is slightly smaller than the Western population. The man size is also smaller. I mean, they are more taller than our population here. So the dose need to be adjusted according to our side. And based on a few trials before in lung cancer, it has been shown that the Asian react towards certain drugs are different from the Western population. So we have to have our own study.
Okay,
To show that to see how our population responding to the combination.
so because we are from a different population, so our response to the medication, how it works for us, whether it creates
Different.
first effects, side effects, they all are taken under consideration. And that's why it is very important to do the trial here in Malaysia.
Correct.
Thank you. Prof. Cheong, how can different stakeholders play a part in ensuring support for Cancer Research Malaysia to conduct similar trials in the future?
That's a great question. As I mentioned, running these kind of trials is really multidisciplinary, right? You need the scientists and then the clinicians, which I've already mentioned. But I think let me just talk about what it takes to run these kind of trials. They are not cheap. Because such trials, sometimes we can get grants for it. So for Piper, we managed to win an international competitive grant, which was really good in order to be able to benefit our patients. But in the main, grants do not really pay for everything. They may pay for the drug and they may pay for some medical related things like scans and things like that. But many a time, other things are not really being paid. And for that, we do have what we call our stakeholders who are the donors. So for example, our clinical trial unit is actually started and funded by funds raised from the Malaysian public under the Bold and Beautiful campaign that was run by My Starfish Foundation. So many people, thousands and thousands of people shave their heads, including some of us, myself, and many others in Cancer Research Malaysia, in order to not only raise money, but to bring the awareness of the critical and urgent need of such research here in Malaysia. So I really want to reach out and thank our donors from My Starfish Foundation and also the donors who fund Cancer Research Malaysia like Yayasan Saim Darby and Yayasan Petronas, who really understands the need to invest in Malaysia for Malaysians. So this is very important. While our scientists, if you look at our social media, almost every month you will see us featuring one or two of our scientists where they are clever at winning grants, and some of these are even very international competitive grants. But as I mentioned, these grants usually pay for things like the experiments, but do not pay for other things like machines and infrastructure, which we need the Malaysian public to get behind us. So do come forward and support us.
Thank you. So thank you, Prof. Wan, and thank you, Prof. Cheong. We have come to the end of the webinar. And like Prof. Cheong has said, please come and support us. Yes, Prof. Cheong.
Can I just say something? And I think Prof. Wan would have said it as well if I haven't. So I just want to say the Piper study is still recruiting patients. The firm is not, the study is not finished yet, even though it's looking very positive. So if you are a patient listening in, ask your clinician about the Piper trial. If you are a clinician, please refer your patients to our 5 centers, which is Prof. Wan at UMMC, Penang General Hospital, IKN, HKL, and we also have one in Likas in Sabah.
Okay, thank you. That's a very great sharing and great information. So to whoever that's hearing out there, if you or your family members or your loved ones, your friends who are having this kind of cancers, head and neck cancer, and would like access to the Piper clinical trial, please get in touch with the appropriate hospitals mentioned.
Thank you.
Okay, and as Prof. Wan, do you have anything to say?
No, I think Prof. Cheong has wrapped up all the things nicely, and just a little bit of how do I say iklan here. Like Prof. Cheong said, the patient in the Piper results at the moment looking very positive. So if we can recruit more patients, please, if you know anybody with head and neck tumor, please do not hesitate to contact us and inquire about the trial.
Thank you, Prof. So as Prof. Cheong has mentioned earlier, it's important for public to support us. It's not only about donating, but it's also about creating awareness, the importance of this research, the importance of this clinical trial. So therefore, on the same note, I would like to share on Cancer Research Malaysia's upcoming fundraising events. So, you may be thinking, okay, I want to support, how can I support?
Yeah.
So you can, make a donation to us. You can support us by sharing our Facebook page, our Instagram page, our LinkedIn page. The more you share, the more people will get to know us. We also have a fundraising event. We have a lot of fundraising activity coming up this year. The next coming up one is on the 25th of May. It's called Race Against Cancer, Cancer Research Malaysia's Run. You can take a scan of this QR code here if you would like to join. That's it. So, before just a minute.
I think there's one QR question in the chat
Yes.
box.
I am going to read the chat. Chat. Okay. Okay, so there is a question. So if you have got any questions, please put down your question here. I'm interested in understanding if geographical location can be a factor affecting the different types of head and neck cancer. And I think Prof. One has answered, it's not available in Sarawak because the hospital there already has another clinical trial which recruit the same population of patients. Okay.
I think what he meant is maybe a different part of Malaysia have different part of tumors. Yeah, yeah. The same thing goes. The same thing happening in the whole world. For example, nasopharyngeal cancer very common in Southeast Asia. Very rare in the Western population. Very common in China. But very rare in Japan. Head and neck cancer quite common in Japan, but not nasopharyngeal carcinoma, mainly because of the habit. Another example is in India, mouth cancer or tongue cancer very common because of the bitter nut chewing habit by the Indians, and I think previously in Malaysia as well because of bitter nut chewing. But nowadays, the younger generation, they don't really like bitter nut chewing. So that part of the risk factor has come down a bit. Yeah.
Thank you for sharing, Prof. One. So link for attendance. There will be a feedback form after this shortly. So Prof. One and Prof. Cheong, thank you so much for the webinar this morning. In fact, this month is Head and Neck Cancer Month. So very appropriate topic. I think it's so important to raise awareness among people. There are things that we take very lightly, like you mentioned earlier. When it's hot, when our nose bleeds, oh, it's just the heat. It's just allergy. The simple things that we miss could be showing us something or leading us into a direction that's very important. So like, as Prof. One mentioned earlier, if it goes on for 2 weeks, go and see your doctor. Don't wait too long. Don't try to do self-diagnosis. Don't try to go to the internet and read the information and diagnose yourself. Yeah, so see the appropriate specialist and they will be able to help you through. And as for Prof. Cheong, she mentioned, how important it is for Malaysians to come together to support us and to make this trial and all the trials successful. Okay? So before I end my webinar today, I would like to ask you to fill up feedback form. I just want to know how my webinar went today. Okay, this is a feedback form. Please help me to fill out this feedback form. I would like to know how the webinar went today. Did you like the questions? Did you like the topic? What else you would like to hear? So I know a lot of, again, many of you have requested for the e-certificate of attendance. It will be provided 30 days after this webinar is over. And just a note, moving forward, the next webinar onwards, there will be a minimum donation of RM1 for every e-certificate of attendance that you request. Okay.
Thank you, Vishala. Thank you, Prof. Wan.
Thank you for having me.
Thank you, Prof. Cheong. Thank you, everyone, and
Okay, thank
have a good
you.
day. Thank you.
Okay, bye-bye.
Bye-bye.